Hello and welcome to our discussion of nursing and allied health, specifically related to the legal operator status. In this video, we are going to be covering an overview of nursing and allied health reimbursement, the legal operator status, a non-provider operated program, wholly owned programs, and joint operated programs. So as an overview, certain providers are eligible to receive cost-based pass-through reimbursement for the costs of approved nursing and allied health education activities. Now, there are certain criteria that must be met before they become eligible for this reimbursement. Specifically, they must be approved and accredited, and the provider must be the legal operator of the program, or if they are not the legal operator of the program, they must meet certain criteria to be eligible for partial non-provider operated cost reimbursement. Now, this legal operator status and the non-provider operated programs are the main topic of this video. The regulation in question here is 42 CFR 413.85. That's going to give us all of the requirements for both the legal operator status and how to handle non-provider operated programs. So continuing with the overview, providers that are actually the legal operator of the program may be eligible for reimbursement for both the classroom instruction costs and clinical training costs. Now, the reason that's important is that if it's not a provider operated program, they are not going to be eligible for classroom instruction costs, and instead they would only be eligible for clinical training costs, and furthermore there's a limit to this. Now, this of course assumes that the program is eligible at all as a non-provider operated program because, as I mentioned before, there are specific requirements that must be met before that can happen. Now, just digging into the two different types of costs here, we have separate discussions, separate website information on classroom versus clinical training costs. But the classroom costs, also known as didactic costs, this is where there is actually a regular scheduled class and a grade is issued. So this is training outside of the clinical area. We're talking textbook type training, just in the actual classroom. And then there are clinical training costs as well. And this is where you're actually training in the clinical area, hands-on type training. They're seeing things in action. You're learning in the actual environment where clinical training is being provided. The other important piece to note about this is that with these clinical training costs, we are concerned with what the incremental cost is for this training. In other words, because of the fact that it's a clinical area and you're already taking up square footage, you're already doing certain activities just because you're a provider, you're operating in that area, we're concerned with what is in addition to that. You're not going to be reimbursed for all of the costs of that area because some of them would have existed regardless of this training program. So we're only going to be allowing the incremental costs that in the absence of students would not have been incurred by the provider. Now, we have a few examples of those later on, but that's an important note to mention, and I'll bring it up a couple of times. So now digging into the legal operator status itself, to verify that the provider is actually considered the legal operator of the program, the provider must, per these two regulations, first of all, they must directly incur the training costs. They must directly control the program curriculum. They must control the administration of the program, employ the teaching staff, provide and control both types of training, the classroom instruction and the clinical training, and finally, they must issue the degree, diploma, or other certificate upon completion of the program. Now, in the regulation, the very last clause of that regulation states, absent evidence to the contrary, the provider that issues the degree, diploma, or other certificate upon the successful completion of an approved program is assumed to meet all 5 criteria. That's in the regulation, but it's important to understand, and we'll see this in just a little bit, that does not mean that those other criteria do not matter anymore. They all must be met. So we'll see that change request in just a bit. Now, the regulations are very specific that the provider, so they use the term the provider must do all these things. If you read the regulation at 42 CFR 400.202 that defines a lot of terms used throughout the regulations, they define the provider specifically, and it's very clear in that definition that any sort of foundation, a home office, or other educational institution is not a provider. By provider, we're talking about the hospital. So the hospital must meet those criteria, not some other entity that happens to associate with the provider. That's a key phrase for this review, key statement. So taking that a little bit further, if a program is operated by an educational institution that happens to be related to the provider through either common ownership or control, that's not sufficient to meet the provider-operated criteria. They may still be a non-provider operated program. They may meet that criteria, but they will not be considered a legal operator, and they will not see all the benefits of legal operator status. Now, the other thing I wanted to mention here is that if a degree is granted rather than a certificate, it's more likely that that program is not going to be considered provider operated, because it's much more likely that there's actually an educational institution that they're dealing with that issues that degree. Hospitals generally don't issue degrees. There could certainly, and there have been exceptions, but they're very, very rare. So if we come across a situation where we're seeing a degree and not just a regular certificate, then that's certainly going to be scrutinized pretty heavily to make sure that that's actually the provider issuing that degree. Now, here is the phrase, here's the statement that I was referring to earlier, the change request. So regarding the 5 criteria that must be met for legal operator status, as well as the degree or diploma, CMS recently issued clarification to both MACs and providers that that particular regulation does not mean that, hey, a diploma or certificate can be the only source in determining legal operator status. All 5 of the first criteria must be exhausted first, must be met first. And this was change request 10552, issued back in 2018, August 17th of 2018. It clearly stated that you cannot just meet the degree or diploma or certificate, you also must meet the 5 core criteria. So that's on our website here. And if you go to our website, www.wpsgha.com, we have a nursing and allied health section with a few different articles on there. And you can see information about the legal operator status. That information about the change request is there as well. One thing I also want to mention is that there's a questionnaire available also. And you can see there are 2 different versions of that form, a regular form and then an ADA compliant form. You can download that, and you may have already seen this questionnaire sent out to you during the time of an audit. A lot of times the auditors send this out when they're going through this review, but we have posted it to our website to allow you to see it ahead of time and prepare for it. You can fill out this questionnaire, and that way it'll help support your provider-operated status. So if we take a look here, we're going to go through that questionnaire, question by question. But this first section I wanted to show you is just the heading, the intro to that. Of course, you're going to list out the provider name and provider number, what your fiscal year end is that's under review, and then importantly, the specific nursing and allied health program that you're talking about. If it's a nursing school or some paramedical school, then we need to know what that is. Paramedical program. We need to know the name of that, and potentially even the cost center that you have used on the cost report. A nursing school would go under worksheet A, line 20, and the paramedical programs or the allied health programs would go under line 23 in subscripts. So if the name doesn't match exactly what's on the cost report, then it's also a good idea to include the cost center that you've used, the line that you've used, so to speak. Now, in red here, we have a statement that all yes answers throughout this questionnaire must be supported with documentation. It's not enough just to attest that, yeah, we met it. During an audit, we need to see the evidence that supports how or why you met that criterion. The other thing I wanted to mention is, first of all, if you don't have documentation, then that yes is not considered a valid yes. It will be flipped to no. And also, if any of the responses on the questionnaire are no, then that means you have not qualified for legal operator status. It's all or nothing. All 5 of the criteria, plus the degree or diploma, must be met for provider operated status, for legal operator status. We have a link to that change request 10552 that we mentioned earlier. You can click on that link and that'll take you directly to the CMS website. It is a public change request, so everybody can see that. And then there are also some exceptions that we're going to be talking about toward the end. The wholly owned subsidiary exception and the joint ownership exception, or the joint program exception. So we'll talk about those two later, and that requires additional documentation as well. So requirement 1, this questionnaire, in addition to being required for the audit or used during the audit, it also provides a little bit of training to the provider community or anybody else to show what we're really looking for with this type of documentation. So question 1, did the hospital directly incur the training costs of the program? So we have a little blurb under there talking about what this means, how you would document it. So again, this has to be the hospital itself that is incurring the training costs, not any home office or some other entity. It has to be the provider, the hospital, and it has to be reported directly on the provider's trial balance. If there's any sort of reclassification or adjustment, including an A81 related party adjustment that incorporates that cost into the cost report, that's in and of itself is not sufficient to be considered as direct incurrence of the cost. We need to see that trial balance from that provider, from that hospital, and any other financial documentation to show that, yes, the hospital has directly incurred the cost. Without that evidence, this will be flagged as a no, and the legal operator review will have failed. By the way, I want to note that underneath of every step is the specific regulation subsection, subparagraph, so you should be able to see that. Requirement 2, does the hospital have direct control of the program curriculum? So the evidence that we might see could include some contracts or board minutes detailing any changes to that curriculum and who has approved them. That shows that somebody controls that program. If it's the provider approving changes to it, then that certainly helps to support they control the program curriculum. Now, the other thing I want to mention here is that this is the main program curriculum. This doesn't necessarily mean they need to teach every single course. As this second note says, the hospital may enter into an agreement with an educational institution to furnish basic academic courses required for the completion of the program, but any of the core courses must be provided by the hospital. So any courses relating to the theory and practice of the nursing and allied health profession that are required for the degree, diploma, or certificate, those must be provided by the hospital themselves. So that's one of those areas you want to take a look at and just identify what courses are more basic, just basic academic courses that would span multiple programs, multiple degrees, versus the actual core courses for this nursing and allied health profession. We need to see the documentation there. For requirement 3, does the hospital control the administration of the program? Now, administration, there are a few different things that could be rolled up under administration. So the note here says that control of the administration of the program includes, but is not limited to, collection of the tuition, that's an important aspect, controlling the maintenance of payroll records of teaching staff or students for their stipends or both, and number 3, they need to be responsible for the day-to-day program operation. Again, we wanted to mention here that the hospital can contract with another entity, and your best example would be payroll there. Certainly they can have somebody else involved with payroll, but the provider must maintain control over all of those aspects of that contracted function. So that's the key thing to mention there. They have to control the administration. That doesn't mean they directly perform every single step, but they overall have to control it. They have to approve it. They have to set up the contract, all of that. Number 4, does the hospital employ the teaching staff? Now that's pretty straightforward. There should be a direct employee relationship or contract relationship with the teaching staff. So to support this, you would need to list out all of the teaching staff in each program, and then obviously evidence any sort of employment relationship or contract relationship. Number 5, does the hospital provide and control both classroom instruction and clinical training where classroom instruction is a requirement for program completion? So here we want to see some documentation supporting what curriculum is included. What are we discussing here? Contracts showing who provides and controls the classroom curriculum and the clinical training, both of them if they're both in existence. And those two, or those types of evidence, should be submitted to support this criterion. And then finally, we get to that extra criterion about the issuance of the degree or diploma. And here, again, we need to see a copy of whatever degree, diploma, or certificate is the end result of this program. If there are none issued, so there is no certificate or anything issued, we need an explanation as to why. What evidences completion of this program? There's generally going to be something, and this needs to be an actual copy of a living version of this diploma. So an actual signed and dated copy of the diploma, not just some sort of template. We need to see one that was actually issued to somebody. And it needs to be very clear what entity is actually issuing this diploma and who is authorizing it. If that entity on the diploma is not the exact name as the provider, and again, even if it's close, we need it to be exact, or if it's not exact, we need a very good explanation as to who that entity truly is. If it's some other related entity that just has a very similar name to the provider, but maybe there's extra words to it, we need it to be very clearly stated who that is, because keep in mind, if that's issued by another party, that would not be allowable. And then at the very bottom here, since this is an attestation, we need to see a signature and date for the administrator, controller, or officer of the hospital, some approved, authorized individual. So those are the requirements for legal operator status. Now again, that's the easiest way to get reimbursement for this type of program. But just because you do not meet one of those criteria does not mean that you can no longer be eligible for any reimbursement whatsoever. There are reimbursement mechanisms for non-provider operated programs as well. However, there are some additional requirements, and the benefits and reimbursement is not quite the same. So continuing on to this discussion, cost incurred by a provider or by an educational institution related to the provider by either common ownership or control for the clinical training. And we have that italicized because that is the only type of cost that could potentially be allowable. So if it's for the clinical training of students enrolled in an approved nursing allied health program, again, it's not operated by the provider, that's why we're here, it may still be paid on a reasonable cost basis if some of these additional criteria are met. Just as a note, a reminder, any of the classroom instruction costs, those didactic costs, those are not included. They're not allowed in this non-provider operated situation. They would only be allowed if the provider was the operator of the program. So if we're going under this new path, the non-provider operated program, those costs should not be included in your line 20 or line 23 cost centers. They're not allowable costs. Now, just as a reminder from something we said earlier, for non-provider operated programs, the only allowable clinical costs that we're going to be included are those that are incremental. In other words, if that cost would have already existed regardless of whether the training is being provided or not. In other words, if it's just a regular clinical type cost that you're going to incur in providing services to patients, then that cost is not going to be allowable. It's only the incremental costs that the addition of students adds additional costs. That's what we're talking about here. In other words, because of this training program, we now have to incur all of these additional costs, maybe some additional space, additional supplies, additional staffing. Those costs are what we're talking about here. So a good example would be square footage. Because keep in mind, we're not just talking about direct costs on worksheet A. We're also talking about indirect or general service or overhead costs coming from worksheet B and B-1. They're stepped down through the use of statistics. So square footage, again, is going to be your most common example. If that same space is used just for regular clinical provision of services, and you just happen to now have students operating in that space as well, then that is not going to be an allowable cost. Those statistics should not be stepped down to lines 20 or 23 on worksheet B-1. Instead, they should remain in the clinical areas, the routine or ancillary cost centers that they related to. The only square footage that would be allowable is additional square footage that's needed solely because the hospital is training students. Now, another example might be nursing administrative costs. These are some examples we've seen over the years that we had to disallow. Nursing administrative costs are generally not going to be incremental, as usually they would exist regardless of the training. Now, if for some reason you believe some of that nursing administration time would not have existed before, and now it is going to exist because you're training the students, then we'd need some support for that, some explanation. And the other thing we've seen recently is the inclusion of costs related to a chapel, mostly square footage. The thing is, a chapel in a hospital is generally not going to relate solely to the clinical pastoral education program. It's usually not considered an incremental cost because most hospitals have chapels regardless of whether they train students or not. Now, if for some reason you can support that this chapel absolutely would not have existed without the clinical pastoral education program, then it can be at least considered and reviewed. But generally, that would certainly be a hard thing to prove at that point. The chapel is not just tied to the program. It's generally for patients and families, regardless of whether they have students in there or not. So that's a key thing, a key example to mention there. Again, the cost would be allowable outside of the nursing allied health program as part of your general administrative type areas, but it would not be related to this program. Therefore, there would not be any pass-through cost for this. Some other criteria that must be met. First of all, the clinical training in question must occur on the premise of the provider, the hospital. And second of all, this is one of the more challenging ones because it involves older documentation that we have to find. The provider must have claimed and been paid for clinical training costs on a reasonable cost basis, and we're talking on the cost report, during the most recent cost reporting period that ended on or before October 1st, 1989. We're considering that kind of a base year. If you look at the regulations, they go into that. Now, to meet that criterion, you have to have one of the three things that is met. Either that cost report that contained the clinical training costs as a pass-through was NPR'd by 11/5/1990. That's the easiest situation. If you can prove, hey, we included the cost and it was NPR'd by that date, in other words, just a little over a year after the cost report end date, in that case, it's met. But if that one is not met, then we have to go to number 2, and you have to be able to prove that when you submitted that cost report prior to 1989, that those pass-through costs were claimed. In other words, you included clinical training cost, and in that as-submitted cost report, it was being reimbursed or being calculated as a pass-through cost. If that one fails, then we have to go to the third one, and you'd have to be able to prove that the contractor, the FI at the time, fiscal intermediary, now a MAC, included clinical training costs in the interim rate that was established. So in this situation, for whatever reason, the provider did not include it on their as-submitted cost report, but maybe through subsequent discussions, the provider supported those costs and the contractor included them in the interim rate. If any of those three sub-criteria are met, then the main criteria is considered to have been met as well. By the way, if any of these things fail, then now your non-provider operated status is no longer allowed either. And here's another one that gets a little bit tricky because we're dealing with that same old cost report. So the way the regulation reads, it says in any cost reporting period, in other words, in any future cost reporting period that we're now reviewing, the percentage of total allowable provider cost attributable to allowable clinical training cost, in other words, take whatever clinical training cost we're talking about divided by your total cost, that percentage cannot exceed the similar percentage in that base year cost report, that most recent cost reporting period ending on or before October 1st, 1989. Now, if you just read that regulation, at first glance, it seems like kind of a cliff. If the current year cost ratio exceeds that base year, one could argue that based on this regulation, all of a sudden you're no longer allowable for non-provider operated status. However, CMS did clarify that was not the intent of this regulation. It was just intended to be a cap. So in other words, if your percentage happens to be higher in this more recent year, that's fine. We're just going to cap you at the ratio from the 1989 cost report. Now keep in mind it's a ratio. It's not a raw dollar amount. It's a ratio, a percentage of total cost. Continuing on with these criteria, the students in these non-provider operated programs must actually provide a benefit to the provider. In other words, they do this by providing clinical services to patients, to helping the provider staff provide patients service. The next one, the clinical training cost must be incurred by the provider, or for this particular criterion, it can actually be incurred by an educational institution related to the provider, whereas in the previous legal operator requirements, that would not have been sufficient, but for these non-provider operated programs, that is sufficient. And the other thing here, kind of going back to incremental costs, that same similar discussion, the costs incurred by the provider cannot exceed the cost that the provider would have incurred if it was the sole operator of the program. In other words, if you're operating under some sort of structure that splits the ownership or splits the operatorship of this program, the Medicare program is not going to pay you for something that ultimately is inefficient, that costs more. You're only going to be reimbursed for what the efficient cost would have been, what the reasonable cost would have been of operating that program by yourself. In other words, they're not saying that you, under these non-provider operated status rules, they're not saying that you are not allowed to split ownership or split operatorship, but if you do, you're not going to be able to get extra reimbursement for that extra cost. You're limited to what it would have cost you to operate it by yourself. Moving to the last few slides, we have some of those exceptions. And these are, again, we have the legal operator status, we have the non-provider operated status. These are exceptions above and beyond that. They're relatively rare, and they would certainly be scrutinized if they were claimed. We'd have to take a look at them. But one exception is for wholly owned programs. This is where, and by the way, this is under 42 CFR 41385G3. These wholly owned subsidiary educational institutions or a college can still receive nursing and allied health pass-through costs for the clinical and classroom training if they meet certain criteria, if they can prove that they were a wholly owned subsidiary. So the way this requirement goes, it's effective for portions of cost reporting periods occurring on or after 10/1 of 2003. If a provider that incurs costs for this nursing allied health program that was originally provider operated. So you have to be able to prove that this program was originally provider operated, and at some point prior to 10/1 of 2003, the operation of that program transferred to a wholly owned subsidiary educational institution in order to meet some accreditation standards that might apply for your certain program. In those situations, we could still be allowable. But again, those criteria right there have to be met. And the key thing, continuing on, the provider must have continuously incurred the costs of both the classroom and clinical training at the educational institution. In those situations, this program may still be eligible for reasonable cost payment. So you can read the regulation to get a little more detail out of it, but there are some of the specific requirements for it. Continuing on with that, the payment will be made on a reasonable cost basis if the provider received Medicare reasonable cost payment for those same programs both prior to and subsequent to the date the provider transferred operation of the program. So the key thing is they have to show that it was continuous, that you've been approved all along, you're still receiving reimbursement, and then this ownership changed. And that's fine, everything continued on. If there's any break in that time frame, then this criteria would not be met, this exception would not be met. Furthermore, if the hospital chooses to restructure its programs on or after 10/1 of 2003, that breaks that continuity, and now you will no longer be allowed for a reimbursement of those costs unless the hospital meets regular provider operated criteria, legal operator status. So it all goes back to consistency and continuity. The same setup has to have existed before and after 10/1 of 2003, with the only change being that at some point prior to 10/1 of 2003, the operation itself was transferred to a wholly owned subsidiary educational institution. So that is one exception. Continuing on there, this goes back, this is similar to the provider operated status. You'd be able to receive reimbursement for the clinical training costs as well as classroom costs, but only those classroom costs for courses that were included in programs that were originally provider operated before the transfer to a wholly owned subsidiary educational institution. So what this really relates to is, remember, with the legal operator status, it has to be the provider controlling everything, and now all of a sudden this separate entity is involved, this educational institution. In and of itself, normally that would violate the requirements, and you would no longer be eligible for any reimbursement. But what the Medicare regulations are saying is that we'll make an exception in this one situation. So even though it's no longer the provider truly operating everything, here's the one exception where you might be able to be pulled back under provider operated status. But it's a pretty stringent regulation, as you can see here. Another requirement, or another exception I should say, is with a joint operated program. So as the name implies, you have two or more hospitals jointly operating a nursing allied health program. Now, there was some discussion on this in the January 12th, 2001 Federal Register. We know that the program must be hospital operated and not operated by some other non-hospital entity. We just talked about that. But there might be multiple hospitals in this situation. They're still hospital entities. It's just that there are more than one. It's not just one provider. So as long as all hospitals involved meet the hospital operated criteria, and as long as each hospital only claims their portion of costs for what they have actually trained, then this is still allowable. It's still a provider operated program. It's just now multiple providers. The key thing to point out here is that no hospital can claim any costs salary, square footage, anything for time spent training at another hospital. So obviously this becomes a little bit more difficult to support because you have to show how much training was performed at each individual hospital and how much cost relates just to that training. So that takes us to the end of our nursing and allied health training. Hopefully this has helped to clarify some of the requirements for this, and hopefully you find that checklist that we discussed to be helpful. I thank you for your time, and I look forward to talking to you in the next video.